Hey guys, just want to take a moment and discuss with you a really common condition that we see in the office, and it affects over 3 million working Americans, is carpal tunnel syndrome. Now, carpal tunnel syndrome is something that will give you pain, numbness and tingling in your wrist and your hands, and it's due to compression of a nerve called your median nerve, right where your wrist meets your hand. However, before we go over exactly how we can diagnose and treat that issue, I just want to discuss with you your posture essentially and the integrity of your cervical spine and your discs. Because the American Medical Association came out with a great study recently that said over 70% of carpal tunnel syndrome actually originates in the neck and isn't an issue within our wrist. So when we go over essentially what we should see in a good in someone's posture, we should see something that looks like this. So when you evaluate good posture, you should be able to see the ear meet the shoulder. You should have a nice even curve in our neck, measure around 40 degrees. And when that happens, the weight of our head, which weighs around 12 to 15 pounds, sits at the back of the bone here where it's supposed to be carried. But all that corporate lifestyle, that sedentary lifestyle, over time, we lose the curve in your neck. Slowly but surely, this crushes the discs, and that's when we start running into some real serious issues, particularly pain that originates in the neck and then also ends up in the hands and the fingers. So when you evaluate a healthy disc that's loaded correctly through good posture, essentially should look like a jelly donut. In the middle you've got the jelly, which is essentially the fluid of the disc, and on the outside is the breads, that kind of collagen fibrous tissue that keeps the disc keeps the disc fluid within the disc. And obviously a healthy disc should see a nice plump healthy disc. However, that poor posture that we just went over causes some damage to the disc, and damaged discs look like this. Essentially what we see is that jelly within the disc, the fluid, through excessive stress and tension, that fibrous tissue essentially becomes damaged, and that tissue, or pardon me, that fluid starts to leak onto that nerve. And obviously when that nerve is compressed, then you're going to get pain, and where the nerve starts and or where it finishes. So if you're suffering from carpal tunnel syndrome and you're struggling for some relief or struggling for some answers, I encourage you to see a chiropractor or come down and see us at Advanced Health. We'll evaluate your cervical curve, the posture of your neck, both for its structure and its function. And if we find an issue there, that's where we start. We have great success rate with our carpal tunnel syndromes. Over 80% of getting people functioning without pain and problems, without the use of drugs and surgery. So again, if you're suffering from carpal tunnel syndrome, you have a family member, a loved one that suffers with it, and they're struggling to get results, like, share, tag them in this video. We'll see you on the next one.